Boom. And we are live with another episode of the Brown Water Banter podcast. My name is Jared Seymour.
My name is Joey Cates.
That's right. And we got a great show for you in the studio. Dr. Joseph Cox from Bienville Orthopedics, man. We're going to be talking about all things orthopedics, all things spine, local community healthcare system, man. It's going to be a great episode. But before we jump into that, like we always do, we have to thank the people that keep the lights on for us over here at the Brown Water Studio. Right out of the gate, Dr. Robbie Williams over at Southern Magnolia Smiles, man. If you're looking for a great local dentist, they are located right here on Washington Avenue in Ocean Springs, man. 2024 is the year to smile more. So when you're ready to book that consultation and get those pearly whites shining and looking good, you can give them a call at 228-215-1202 and tell them that Brown Water sent you. If you find yourself in need of legal representation for any reason, Taylor & Cox Law Firm has been practicing law on the Mississippi Gulf Coast for over 30 years. That's our buddy Tyler right there. They specialize in felonies, misdemeanors, DUI, family law, divorce, child custody, you name it. If you need somebody that's going to fight tooth and nail for you, Taylor & Cox Law Firm is the law firm for you. Give them a shout and book that consultation at 228-696-0111. It is officially October. You have missed your New Year's resolution by a long shot. But if you're still looking to get back in the gym and get off the couch, you want to start living healthy and take control of your health care, I guess is the best way to put it. Forever Young Men and Women's Health is for you. This is Kendrick right here. You can look them up on Facebook, Forever Young Men and Women's Health. They specialize in getting you right back on track. Book a consultation with them. Get some lab work done. Check your, see if you're vitamin deficient, hormone deficient. You know, they specialize in testosterone replacement for both men and women. Yes, that's right, men and women. Give them a call at 228-363-6623 and let them walk you through it, man. It's a good thing, man. Get back in the gym and start feeling better, start feeling healthy. I know I smoked you on that one, Joe.
Oh, yeah.
No way.
Not even close.
Yeah, we got to figure something out with that.
Yep.
But anyway, so you keep doing your thing. Dr. Cox, man, first of all, thank you for stopping by here this evening. This has been a couple months in the works, trying to get you in here, mainly on us not having it done. But I'm glad we finally got you in the studio. A lot to talk about this evening. Bienville Orthopedics, I'm sure people in the community, I know they're familiar with the name for sure. Right down the road from us here. You didn't even have that long of a drive to get here today, did
That's
you?
right, about 6 minutes.
It's easy to get
Clocked
there.
out, just walked on down.
Pretty much rode his bike down the road here and got to us. But so where we like to always start with the guests when we have them in the studio here is kind of your backstory before we get into Bienville Orthopedics as an institution or a healthcare system. For you, we're born and raised here. Are you from the Gulf Coast? I'm not sure.
I'm actually from Birmingham, Alabama.
Okay. All right. We won't hold that against you. But, so
right.
tell us your backstory. How did you end up here on the coast? You know, walk us through the path of becoming, the doctor that you are today.
Yeah. So started at an early age. Always knew I wanted to be a doctor. And so just set my sights on it early.
I'm always jealous of people that knew that.
Yeah.
I don't know where it came from.
Yeah. How did you know? How did you know?
TV show, movie.
I remember making solutions in my bathroom and putting them on my brother's cuts,
Okay.
soaps of all kinds,
All right.
all that kind of stuff. It just felt like that's what I need to be doing, healing people. So,
Okay.
Sweet.
I like it.
Not sure those solutions made
They worked, yeah.
Probably made it worse.
Yeah. But you got to start somewhere.
I guess so.
Yeah.
So Birmingham, born and raised, ended up going to Birmingham Southern College, and again, knew I wanted to do medical school. When I came out of there, went to UAB, which, massive university there. I think I counted them at one time. It's probably bigger now. It was like 60 square blocks. I mean, the institution is just massive.
Yeah. Did they have a football team then?
They did.
They did.
Yeah.
Because I know they lost it, didn't they? Then
They went a few years without one.
Yeah.
And came back before I got there, actually.
Yeah.
There was a big uproar in the community. A lot of local supporters that really enjoyed going to UAB games, and you see them on TV. They play hard football, so
Absolutely.
it's fun to watch.
All right. Okay.
And then from there, wanted to do orthopedics. I guess I tell the story. My dad was an orthodontist, and he had a patient whose dad, obviously orthodontist, taking care of kids, mostly adolescents needing braces, and he had a kid that we needed to go see after one of my little league baseball games on the weekend. She had a little wire sticking her in the gum. And so we went over on a Saturday afternoon, and we're sitting there talking, and her dad's an anesthesiologist. So he offered to let me come and shadow and, be in the operating room with a bunch of different surgeons. Again, things that I thought I might want to do. And went into the cardiothoracic room, and it's classical music. It's very tense.
Yes.
They're operating on someone's heart, and it didn't seem fun to me.
Right.
At the time, I was probably 16 or 17. And then we went over to the general surgeon's room, and they were having a good time. They do some really cool work, and I even appreciate it more after I went through medical school and on into doing what I'm doing now. We have some amazing general surgeons in the community too. But then we went in the orthopedic room, and they're jamming out the AC/DC.
Yes.
And using hammers and saws, and that's what I spent my weekends and my summers doing, is building stuff and working construction, and it just seemed to fit. So I knew that's what I wanted to do.
Joey teaches carpentry, or did. He did.
Yeah.
And I tell him all the time, like, dude, like orthopedics is just like your shop class, except on a human that you got to keep alive. It's the same thing.
And it's brutal. It's brutal. Some of the stuff they do in there, and it's crazy.
Yeah,
when you think about running screws and hammers and stuff like that, you think about that in the carpentry shop. You don't think about it actually using it on your body, but they do it every day.
Until you need it. Until you need it as your best friend. But it's funny you say that, because I do feel like I was having, my oldest son's 15, and I was telling him the other day, like, what do I do now? I'm like, you need to get a good job. I'm like, orthopedics, that's what you need to do. I'm like, because it's like, I mean, it's in a good way, but it's like a bro thing. It's like, like you say, like hanging out in the room. It's a little more not laid back, but just like rock music. Like, I don't know. I just, in hammers, nails, it's like more relatable.
Yeah, I think so. I mean, it depends on who you are.
Right. And what you're doing, for sure.
We've got a lot of different personalities in orthopedics, and I think that serves the population well. Right. So, not everybody's a bro, but but yeah,
I meant that as a compliment.
Yeah,
for sure.
Enough of them.
Yeah. But so you knew that's what you wanted to do after that rotation, and that's prior to med school too.
That's where it got sealed.
Yeah.
And that was in high school still. Actually, when I rotated with that guy, so I went through college knowing I wanted to do orthopedics, got into UAB, and from UAB. This is going to turn into two stories a little bit, but that's where I met my wife, Lindsay. So she's an OBGYN.
Right.
And I'm going to talk a little bit about her too.
Yeah.
But,
pleasure to work with. We love working with her.
She's amazing. She's actually just voted top doc in the Gulf Coast Women's Magazine.
Awesome.
So,
I think I saw that
for
at
OBGYN,
the hospital. Yeah. That's awesome.
She's doing awesome and just treating patients like family. And that's what we both like to do. But yeah, so let's see. We got together. She was actually military, is still military, and that's part of our story of how we got here. Wright State, actually, in Dayton, Ohio. Wright-Patterson Air Force Base is right down the road, and so it's the only hospital in the country at the time. I don't think there's another one still, but only hospital in the country where she could do Air Force OBGYN, and I could do civilian ortho, and us be in the same building essentially.
Oh, wow.
And so we kind of gunned for that position, or those positions, and we got them. And so 6 years there for me, 4 for her. She got stationed down here after her 4 years, and that's when we really got introduced to the Mississippi Gulf Coast and fell in love with it. We started off, her coming up once, I guess every other month, and I would go down in the in-between months. So we were trying to see each other once a month for 3 years, actually. And during that time, we decided, you know what, why don't we just try to always go to the Gulf Coast instead of going up to Ohio?
Right.
So that's what we try to do. But
decisions were made. Yeah.
We really did love it here. And again, that's a slightly separate story, but 6 years orthopedics, general orthopedics for me. And then somewhere in there, 2 or 3 years before I graduated, I decided I wanted to do spine surgery. And so I went down to Dallas, Texas, and I did a year of spine fellowship in Texas before moving here and starting to practice.
Yeah, I'm glad you brought all that up, because that's one of the things that people, especially if you don't work in healthcare, people think.
Yeah, I'm over here just trying to decipher, hoping I'm smart enough to dumb it down everything else while y'all are going there.
Right. But like you think about like doctors, like, oh man, they have great jobs and make great money and all this, but people don't realize like the struggle is real. Like to get where you are today, you put in a ton of time. When you said 6 years, that's after med school, right? Like, right? Or you count? So 4 years of undergraduate, 4 years of med school. Now we're at 8.
Yep.
Joey, and then 6 more on top of that.
And plus a year
for spine. Yeah.
So the spine was what you specialized in. Is that kind of what it goes? Yeah.
Well, orthopedics is a specialty in and of itself. Then he went further than
into
that.
it.
Yeah.
Okay.
Specialization. Yeah. So that's what I like to spend 99% of my day doing. I take some trauma call at some of the local hospitals and, deal with some broken bones. and emergency type things. But yeah, I try to spend most of my time doing spine.
Really?
Yeah.
What when you're doing the orthopedic fellowship like you're doing, why go to spine? Like what was that? What intrigued you about that made you want to do that other year?
I really liked that every patient was a puzzle.
Okay.
Every broken bone and every arthritic knee and every, rotator cuff tear is a puzzle, certainly. And it's all hard and it all takes a lot of thought and a lot of planning. For me though, I felt like going into spine, I really had to study these images, and there's so many levels. And, do you just do a 1-level surgery or treat 1 level, or do you do 3, or do you do 10? All these questions are in every single interaction that I have with a new patient. Trying to get them through, trying to get them better with conservative measures first.
Right.
That's always the goal. Nobody really wants surgery. And if we can get you better without surgery,
right?
then
When I was growing up, my uncle had it, and it was almost like you're almost better sticking it out, taking the pain, because back surgery back in the 90s, 80s was almost as bad as just sticking it out. You know what I'm saying? And it's changed a lot since then.
It really has. There's a lot of technology that's come through. And just like our information availability on the internet and how much it has progressed, if you think about to the 90s, to the early 2000s to now, our technology in all of orthopedics, all of really healthcare, but spine specifically, it is progressing just that fast also. And so what we can do now is not the same thing, and not the same things we understood 5 years ago, and certainly not 10 years ago or 20 years ago. And I think we are making better decisions with better tech. Even just an MRI, we have better quality MRIs now than we had 20 years ago. And so you can make better decisions for a patient based on that stuff. I do think that, neck surgery is different than low back surgery. Low back surgery is still something that you have to think long and hard about, but generally we get good outcomes. And, I sort of joke with some of my patients, but I'm like, that's why I still keep doing it. If it was a bad surgery, if I had a lot of upset patients, I couldn't sleep at night, and I wouldn't want to do it anymore. I would go find something else to do.
Like you said, this whole journey started with you wanting to help people, help your brother, right? What you're making concoctions there. So and that's a good point, Joey, that you bring up. Like you said, and I don't even think about that sometimes. Like you say, technology is just running crazy right now, and that's in all aspects of life, not just your cell phone and social media and AI, right? It's in all the robotic stuff that we do now. It's crazy. It's wild to even watch that. And can you talk a little bit about how that's how y'all use that in spine surgery, orthopedics in general?
So little plug. I was privileged enough, I guess, to be part of the first robotic spine surgery in Mississippi. So that was a really high honor and privilege. I did that with Dr. Graham. So Dr. Eric Graham, we were both, I guess I came out of training, having used the robot in my training, and actually worked with one of the guys who built the Mazel robot. Really started it, him and a software engineer, essentially, from another country. Got together and started building this robot back in the early 2000s, and just troubleshot. And when I went through fellowship in 2018, it was part of our everyday, and it was amazing. And then obviously within just a couple of years, it seems like every hospital in the country had a robot of some kind. There's only, at the time, there's only 2, and we got ours. And so we got it. It was at Ocean Springs, and then Memorial got one shortly thereafter, actually one of each. So robotics and spine surgery. Since it came out, since we got it at Ocean Springs, the technology has advanced, and we can do a lot more with it now than we used to. I still don't know that I get a lot of questions. Are you going to use the robot on my surgery? Well, right this moment, well, at least for me, I'm not using it in the neck. And I actually don't use it in the low back very often, almost never now, just because of some of the technical problems that some of these technology advancements have had. And so I think most of us kind of pulled away from it a little bit, waiting on the technology to catch up maybe. It doesn't always.
You trust your hands way more than the robot.
So the robot doesn't do the surgery, right? A robot.
You got to dumb it down for me. I don't understand.
A robot doesn't make a bad surgeon a good surgeon. It makes a thoughtful, good surgeon maybe a little tiny bit better, maybe. But there were times when I didn't trust the robot, and it was making me do things, or wanted to make me do things that I didn't really want to do. I was looking at the x-ray and looking at my screw trajectory, and I'm like, I don't think that matches. And so, yeah, you have to kind of call it off, abort, and go freehand,
Right.
which freehand is still, I mean, I feel very good about freehand. I think most of us feel very good about freehand. And I mean, you really want to get into the deep stuff. If you come out of training right now and you've never put in a freehand screw, that's scary to me.
Right.
Yeah.
You need to be able to do it freehand. Like, what happens if the robot's dead today? You know, it got a glitch, got a virus, whatever it is. You got to be able to do it without the robot. And you got to be able to double check the robot. So robotics are awesome. It is the wave of the future. There are some really cool things with these overlay goggles that you can put on and look down at your patient, and using some sort of reference jigs, it lays the spine out on the patient. You can see, and you can move your head around, and you can see where the spine is. And assuming that's correct, you can put your screws in essentially with a 3D model right in front of you. Again, you still got to double check everything. And maybe we'll get to a spot, and we probably will. I mean, we'll have self-driving cars in a few years, right?
Yeah.
And we'll probably have robots that can do a lot of things that
at home
they can't do.
Yeah.
Maybe in the garage.
Well, I mean, Tesla just rolled out, what was it, Optimus?
Yeah, the little
20
crazy robot. Yeah.
Full humanoid. He says,
Clean your house.
Yeah,
all
Elon
that
says
stuff.
it should be between $20,000 and $30,000. He's going to fold your clothes and walk your dog for you. So we'll see.
Man, that would be nice.
Yeah, wouldn't it though? I mean,
I don't know about spine surgery. I don't know if I'm gonna hook up to him, but I'll go with the folding the
Dr. Couch will
clothes.
still be there. For
Yeah.
Sure he's all right.
20 years.
I think my job's safe for now.
Yeah. I think you got
a few more years,
healthy career. You know that you'll be all right. But no, yeah, the robots are the stuff that you're mentioning though, like the 3D with the goggles and stuff like that. It's just, it's a wild world that we live in, and it's all going to make, like you said, decisions better, right? Hopefully, like patient outcomes better. All that type of goal, right? That's the whole goal. That's right.
I mean, we want them to be the best that they can be right now, but eventually, I mean, probably one of us sitting here at the table is going to have some surgery, maybe on our back. And
some of us might have already had surgery.
I mean, we need to be pushing. You know, I work with a company now, and they're doing things that I'm not involved with on all aspects, but you know, we have to continually evolve what we've got now in order to make it better for the people that we're treating now, and also for ourselves as we age and get into that part of life that, you know, where we might be hurting and struggling.
That's one thing about healthcare, is that eventually we all become a customer.
A patient.
Patient.
Well, the VR is cool because, I mean, now you can jump on with the greatest minds in the world and be sitting right there at your table instead of jumping on a plane and flying 12, 20 hours, wherever that is, right?
Yeah.
Just taking a class, doing training, stuff like that.
Yeah. You mentioned that before we went live. Can you touch on that? Like you did some kind of education stuff?
So, let's see. So, there is a way of doing a lumbar fusion called a lateral interbody fusion. So that's where we put in spacers actually through the side. So we make a small incision on your side. It's considered minimally invasive. We're able to get a lot of work done through a tiny little incision. Sometimes patients need screws in the back, and we'll make little poke holes and put screws in the back just to kind of anchor things. And sometimes they don't. Sometimes we just need a little anchor on the side of the spine, and that's good enough for their body and their anatomy to get the fusion and treat the problem that they have. So this lateral interbody fusion is a surgery that's been around since the late 2000s, early teens. So it's not really that old. The backstory for me is that when I was going through residency, one of my mentors, this is 2012, 13, and I started getting attracted to spine, and we're going in the operating room, we're doing these lateral interbody fusions. So the way you do it is you lay the patient on their side in order to get between the ribs and the iliac crest, the hip bone. You got to break the table, and when you do that, it kind of becomes unstable for the patient to be laying up there. And so you use about 6 rolls of 3M tape. We all bought stock in 3M tape.
Yes.
Duct tape them down.
Exactly.
But a ton of tape, and it took 45 minutes or an hour just to get the patient positioned. Jared, you probably saw some of this.
Oh yeah, no, 100%.
So you get it all set up, you drape the patient, and you put in your interbody. Well, now if you want to do screws, you take all the drape, you close the wound, obviously. That part's done. You take the drapes down, you bring in another bed. Everybody's got to roll the patient to another bed while they're on their belly, which is your standard kind of typical spine surgery. and then you put your screws in. So it was inefficient. It was relatively new at the time. We've gotten better and better with that particular technique. And I guess fast forward up until about 2018, 19, the guy who invented that surgery, or really was the thought leader in it and developed the protocol or the technique, is named Luis Pimenta from Brazil. But he sort of developed a new way to do it. So let's do it instead of laying the patient on their side and then on their belly. Let's just lay them on their belly and then operate from the side. And of course, at first, everybody, all the spine surgeons are like, I just don't know.
Yeah.
That sounds
Change
ridiculous.
is bad. Yeah.
And it is scary to do something that you haven't done ever if you're out in practice. And it is also, somebody has to sort of pass the information to the next guy and the next guy and the next guy. And it takes it hold in a training program, and then the young guys learn it. And that's sort of what I was saying a while ago, is this guy had learned the lateral decubitus, which is laying the patient on their side, way of putting this interbody. And I just learned it. I just thought it was the way that spine surgery was done. I did not know that it was, a 2-year-old technique, and the patients did great. And I was like, man, this is awesome.
Mm-hmm.
If this is spine surgery, I'm in.
Yeah.
And so, fast forward a few more years, and I understood as I read more, not just about the technique and how to treat a patient, but about the history.
Mm-hmm.
I realized how new this was. So again, a few more years, and I'm just coming out of fellowship, about to graduate maybe. And I got introduced to Luis Pimenta through my mentor that made the robot. And basically he said, Joe, I would love for you to adopt this. And I said, well, I don't, that's I feel honored that you would say that, but I'm not sure that I can do that. And just same thing that any spine surgeon would say, that's kind of set in their ways and they've learned these techniques. But I went to labs, I went to cadaver labs. I went and scrubbed cases. And then he actually came to my operating room in Ocean Springs for a case where I really, got, I guess my confidence was seriously boosted after that case. And that was actually about my 4th or 5th case with that technique. But now, so I've sort of gotten very comfortable with it. I think it's a great way to treat the correct pathology. You can't treat everything with it. You can't access every level with it, actually. You can't get down to the very bottom at 5-1. But a lot of patients do really, really well with it. So what you brought up, the technology and the teaching. So I've gotten to a point where we came to an agreement, and I said, okay, we have cameras in the operating room, and every first Friday of every month, I usually will do a teaching case where I have other surgeons from all around the country. I've had a couple from Canada. I don't know if any other countries have logged on, but essentially, sometimes 2, sometimes 6, sometimes 8 surgeons from around, we'll just say the country, that are wanting to learn this technique, that maybe have been to the lab and learned it on a cadaver, but just aren't quite sure how to set up the operating room, or, how does the workflow, where does your assistant stand? Mm-hmm. All of these little nuances that you really can't get from reading a book or going to a cadaver lab. And so they scrub in from wherever they are. And they get to watch, and it's 3D. It's like me sitting here at the table with you guys, and you can move around and you can almost look behind people. I mean, you can't really walk around the operating room, but it gives you a real deal. This is how it's set up. This is how it's done. And it's live surgery. And, every surgery has little bumps that you got to work through, and demonstrating that technology for them. Many of them, I can't say all, but many of them are like, all right, this is good.
Wow.
Yeah. We're going to treat patients better this way.
You're doing this at Ocean Springs?
That's right.
And I didn't even know that. And so these cameras are just in the OR. They're like a 3D, 3D camera that just sits there. And then they, like you said, they VR in with a headset.
Oculus.
Like an Oculus kind of situation.
So the company is called Emmertech, and they're sort of, I guess, what their company is based off of is this software algorithm where they're able to compress and extract virtual reality data, which is massive in milliseconds.
Wow.
And so it's just like a conversation like this. I've learned that other virtual reality platforms often have a significant delay of seconds to minutes. Or I mean, I think there was a Super Bowl streamed a few years ago. I was told it was like a 12-minute delay.
Oh, wow.
So, I mean, you can put on your headset, your MetaQuest headset, and be there or feel like you're there, but it's 12 minutes late. And that's cool for entertainment, but you can't do that with live surgery.
Right.
And anyway, so the Emmertech company is brings all this software and hardware in. They do the stream. And the other cool thing is you're sitting here with this headset on, and in the room, I've got a 2D camera looking down over my shoulder into the wound so they can see kind of what's going on in the wound. They can feel like they're in the room. Every time I take an x-ray, it pops up on the left side. You can move these screens around. You can make them bigger, make them smaller.
Wow. Like a video game.
Yeah.
It is. But
immersive.
Yeah.
Extremely
it's
immersive.
very immersive. And it's a good way to teach without having to take away that surgeon's, weekend where they fly to a different state.
Right.
So many of these things are done out in California, like, so many other companies are based. So, if I'm in Mississippi and I need to be trained on something and I want to use this company and their platform or their technology, I fly out to California on a Friday night after I've been working, a week. I'm away from my family. I'm away from my practice. I probably had to take off a day or half a day at least of clinic and seeing patients that, might need me. It's cumbersome and costly to do that. And not only that, usually the company will pay for you to come out there and learn the technique. I mean, they want you to use their stuff, but it's costing somebody money. And so at the end of the day, it's a very cost efficient way to teach as well.
Yeah.
So there's a ton of pros in that. And I've been, again, privileged and honored to be a part of it and participate and share my knowledge, I guess.
Yeah. That's awesome. You mentioned Meta, I've seen even in their like Oculus commercials, the 3D rendering of people looking at anatomy. So I think that's definitely going to infiltrate all types of schooling and education, not just medical, but all things. So that's really cool to know that we have that here, in Ocean Springs, and they're doing that now. That's wild.
It's kind of like, it's kind of weird. It's kind of like almost like a ninja, like he's passing on the guard for you learning the technique, and now you have the technique, and then you pass it on to somebody else.
Young Padawan,
student, Star Wars.
Student becomes a teacher. But
well, here's my last question on that.
Yeah,
when you come up with a new technique and he doesn't have the robotics, how does he come up with the new technique?
You're saying how do you perform something like that if you don't have the robot?
Yeah, well, I mean, like say we didn't know the technique, but he started the technique by himself, correct? Did he just start that on patients that were like, yeah, man, go ahead, sure, go? Or how does that work?
So
how do you develop a new technique?
How do you develop a new technique?
That's a good question.
I think that's a really good question. So
I want to try something today, guys.
Yeah, just walk in and be like, we're gonna do something.
We're gonna do something different today.
At some point, you have that conversation with a patient. You say, I've spent 10 years or 20 years studying this, and I feel very confident that this is how we can treat it. This is my protocol. And just like any drug, right? I mean, somebody's got to be first. I'm not that guy. I don't think. I'm not trying new things on patients here in Ocean Springs or Gulfport.
Right.
That is not, I don't think that's really going on here in town.
Right.
I mean, that's what the big medical, universities are for. And that's where all the, a lot of times patients get paid for being on the front end of
medical studies and stuff like that.
So there's a time and a place for it. We're not doing that here. We're not doing experimental surgeries. But to your question, how do you develop that? Well, you come up with an idea and you study it. And most of these ideas are not, it's not just like a profound, like today we don't have AI and tomorrow we have lots of AI.
Right.
I mean, it's a small trickle of information, and sometimes you make a breakthrough and you're like, oh, we can do this. But a lot of times it's like, you take what you know and you just massage it a little bit, and it comes out almost the same, but you're like, I kind of like that. And you massage a little bit more. And maybe next time you make a smaller incision. And again, I'm not doing that stuff here, but, but that's how it's done.
Yeah. That's a good question, because people, I really didn't even know that. Like we talk about techniques from a surgical standpoint. So.
Somebody's got to be the rat.
Yeah, somebody's got to come up with it too. So. I think you mentioned earlier. Correct me if I'm wrong. You said it was your wife through the military that got y'all down here on the coast. Did I hear that right? Yeah. Okay. And so, how did you get affiliated? Meet whatever? Bienville Orthopedics. How did you become a part of that organization?
So I had spoken with Eric Graham, who he's one of my spine partners, and I've got actually 3 other spine partners, and it's great to have partners that you can bounce stuff off of. And
not on an island by yourself.
One of my partners asked me today about a question about a patient. Hey, what would you do with this? And actually, I guess today's Monday. On Friday, I was sending text out and I said, hey, will you please look up this patient's MRN and look at their images? I've got a problem that is very complex and I need a little bit of help, bouncing some stuff off. So we bounce stuff off each other all the time, but that's a credit to Bienville and the camaraderie that we all have together. But
and the level of education and training.
Yeah.
Right.
Everybody, I mean, there is a very high level of academic knowledge
Right.
at Bienville amongst all my partners. And I think it's encouraging because going through training, you work with a lot of physicians over the years, again, 11 years after college. And you see a lot of things. And unfortunately, they're not all spectacular. And some of that is kind of part of the training and part of learning. Maybe
What
don't
not
ever
to do.
that again.
Yeah. Absolutely.
It happens.
But fortunately, I mean, we've got some amazing surgeons at Bienville here on the coast, and for a small, I guess, relatively small population compared to some of our big city around the country. I mean, we've got some amazing surgeons. So yeah, Dr. Graham, he called me. Well, Lindsay was already down here, and I was like, well, I need somewhere to go after I graduate. She'll still have 2 years in the military. And so I was just looking around. I sent my CV out to all the hospitals, not knowing. I mean, that's the only, I never worked with a private group really. And so just through the hospitals, a couple of private groups in and out, but Eric Graham calls me and he says, hey, you're a young guy about to go into spine fellowship. I'm looking for a spine partner. And I hear you're looking for a job on the coast. And I said, well, I've got 3 years left, but yeah, let's start talking. And so we did, and we became really good friends. And he, at the time, well, just to sort of make it short, he introduced me to Bienville. And we both, he was actually in private practice at the time. He joined Bienville. He sort of helped get me an interview, if you will.
He got your foot in the door.
Yeah.
I mean, it's hard for anyone to recruit someone in that might take some of their business, right?
Right.
And so for me to have that opportunity and for him to facilitate it meant a lot to me. And so anyways, we all liked each other. Dr. Graham has an amazing practice and he was already relatively established. So there was just a little niche for me to work into. And so it, again, took 3 years to get here. Once I got here, it's been, again, an amazing group to be a part of and really honored and privileged to find such a good group of guys and girls.
Yeah. And it's brand spanking all new, isn't it? In Bienville, the new building right here?
I would say relatively new.
Yeah.
Right?
So it was built right before I got here, maybe 2 years before I got here. Don't quote me on that. But, Bienville's been around for 41 years or so. I started with some of the guys that I don't know, haven't ever met. John Drake was he was, in my eyes, I call him the godfather of Bienville. I think a lot of us do.
Recently retired, right?
Yeah, he retired a couple of years ago. He's an amazing human being.
Yeah.
Always looking out for his patients, which is what we all want, right?
Right.
I mean, again, we're all probably going to be patients of something, some maybe not orthopedics, but we'll all be patients of something at some point. We all want our physicians to have our best interest in mind. And so John was always that way. He still is, even though he's retired. Met him outside of work a few months ago. And anyway, he's still asking about patients. How's this patient doing? You remember that patient I sent you 2 years ago? How's she doing?
It's like, come on.
Boy, back in my day, we used to do it like this.
Yeah.
But John's still very active and very sharp and relatively involved, I think. But yeah, Bienville's been around a long time and done some amazing things. And here I am, get to be a part of it and, usher in maybe the future.
Now, one of the things, one of the reasons that sparked this whole conversation about coming on the show is y'all rolled out something new, I guess you would say, new to Bienville. Is this a new thing, not in the country, but like your urgent care side of things, right? And if you could kind of explain the reasons behind that and when y'all got that started, because we've all seen urgent cares. We drive down the Highway 90 all the time. Urgent care this, urgent care that. But this is a little different, and there's some specific reasons why it's different and why it's going to be better for the community. And full disclosure, I was a patient of your urgent care. We can get into that as we go along. But could you touch on that?
Yeah. So our urgent care is an orthopedic urgent care. So if you have a sniffles, we can't really treat that there. But any type of musculoskeletal injury, you twist your ankle playing ball, you smash it with a hammer at work, you fall off a ladder and have a broken leg. I mean, we can take care of most all of that stuff at our urgent care. And so part of the reason is, we had the idea, but when COVID came through and the hospitals and the ERs and the urgent cares were just overrun,
Right.
we really felt like it was a service to the community. And so that's where it was born out of. And of course, we're learning about all this stuff even before we opened the urgent care. But what better place to go when you have a musculoskeletal injury than the musculoskeletal experts?
Right. Correct.
I mean, so you come into the office. We have urgent cares in Orange Grove. So at our Dido Road office, we have an urgent care here in the Van Cleve, Ocean Springs area at the East Lake location. And essentially, you walk in, you say, I'm here with an injury that just happened. And you get put on the urgent care list, and we get you back within a few minutes. We get x-rays right then and there. You have a musculoskeletal expert that looks at those x-rays, and we have a lot of great ER physicians in the community too. But we have, when they get confused about something or it's maybe a little bit complex and they're not quite sure, they call us. We're on call. They call us and we answer stuff over the phone. Well, now you're in the clinic with the doctors and the nurse practitioners that see this all day long, every day. And so you get immediate expert care. If you need a splint or a cast, it gets put on right then. You don't have to wait, 4 or 5 days or a week to get in with the person that they referred you to. And then if you need an MRI, multiple times I've seen torn ACLs. I've seen, ankle injuries, and you need advanced imaging, and we can order that up right then and there. You go down the street and you get it done within a day or two, and you come back and you follow it up. So I guess efficiency or access to care is really big. The other thing is cost. So when you go in the emergency room, they have to support that big facility with all the nurses and all the techs and all the stuff that takes up space, right? Bandages, IV lines, medicines, massive amounts of stuff. And that's where a lot of the cost of going to a hospital ER comes from. Coming to our urgent care is much, much cheaper. It's essentially like going to an office visit. And so it is not only faster, but it's cheaper. And you get the experts that are going to be taking care of you anyway to see it on the first, at first.
Correct.
Yeah. We just cut off the middleman.
I was just fixing to say the same exact thing.
I coached, played ball, of course, my whole entire life. And it's Friday nights, you hurt something, emergency room, you're not going to be able to see a specialist till Monday or Tuesday, whenever they can get you in. Now your room, slide right in.
That's right.
Yeah.
Kill it with 2 stones.
Orthopedics, is bone injury or soft tissue injury. You kind of, like you said, especially if it's trauma based, like you kind of know what you did. You may have abdominal pain. You don't know I have a blockage or I have this or my appendix or my gallbladder or whatever.
But you know what a sprained ankle
If you fall off a ladder and your arm is bending where it's not supposed to bend, you pretty much know.
Yeah, I probably messed my arm.
I think this
probably not my gallbladder.
It's not my gallbladder. I'm pretty sure this bone that's hanging out right here is broken. And so rather than go sit in the ER for 2 hours, 3 hours, clogging them up, like you said, in the middle of COVID, when they were just maxed out at the limits, couldn't handle even what they were dealing with.
And they're just going to refer you to them anyway.
That's exactly right. So now you've burned if you're lucky, you burn 2 to 3 hours. It could be longer than that. To then just be told, hey, you need to see a guy at Bienville, you need to see an orthopedist or whatever. Just cut the middleman out and go straight there. And like I mentioned before we got into this, I mean, that same thing happened to me. I tore my meniscus. I didn't know that's what it was, but I knew this was a injury. This is not normal. This is not right. I couldn't straighten my leg out. It was bad. Bucket handle tear, which I didn't even know what that was at the time. And I work in healthcare, and I was like, man, this is awful. So I knew about the urgent care. I walked straight into the right down the road, Highway 57, and went straight in. I'm like, I have a ouchie and I need help here, and registered in. I was already familiar with Dr. Wittersheim because I worked with him already. So I was like, he's who I want to see. And it's exactly like you said. They brought me back to a room. You got to do the normal check. Are you allergic to this? Health history, all that. But then within, an hour, maybe hour and a half, I had an X-ray. And then I got He wrote for the MRI. I went to Pascagoula to get that insurance because they're terrible. That's not y'all's fault. That's my insurance people. Got the MRI, and I was in surgery, I think 3 days later.
Wow.
And got it fixed. And it was a great experience. And so, for the community, it's a valuable resource to have right here. And you'll have a lot of staff there. You'll have a lot of surgeons, a lot of nurse practitioners, a lot of, techs and nurses there. I mean, everybody was great. It was a good experience in a not great situation to be in.
Right.
And that's just my story. I know, Stephanie's little girl, she broke
her arm or something like that.
You haven't been through there. Ella hasn't.
No,
she didn't hurt herself.
No,
okay.
no.
But I know plenty of people that have went through y'all stuff and had nothing but good things to say.
Yeah.
Well, good.
So,
I'm glad to hear it. And
what
are the hours and days for that? I'm sorry, I didn't mean to cut you off, but what are y'all open?
So it is Monday through Friday right now.
Okay.
And that is just, we're looking to expand into the weekends and later nights. And just like everything else, it's an evolution. We're relatively new with the urgent care. The care is expert and experienced, but the hours are, we just got to get the staff.
And probably get the message out, the marketing part of it, right? So people know.
Right? So if we have the volume coming in on the weekends, then we can staff it a bit easier. So we will work into that undoubtedly. But yes, right now it's 8 to 5, Monday through Friday at the East Lake and or Orange Grove locations. And so we're there for you if you need us.
Sweet.
Yeah, awesome. Yeah. Awesome. I like it.
That'd be killer. I think if more sports high schools found out about this, I think your Saturday mornings would be rocking and rolling. Yeah. After Friday night football games, soccer games, basketball, all that stuff.
Many talks about that. So I think it will be in the near future. I don't have a date, but it'll be in the near future.
Yeah.
Okay. And you said y'all had an event coming up that you mentioned.
The golf tournament.
Okay. Let's talk about that.
So we do Bienville Charity Golf Tournament. We started 3 or 4 years ago. Have a lot of people in the orthopedic community that like to play golf, and so what better way to play golf than to raise money for a good cause?
Yeah.
So, the last few years we've raised over $20,000, I believe. Don't hold me to it, but pretty sure. And then we send it. Donated to Home of Grace, or this year I think we have we're actually going to split it between 4 different charities.
Yeah. Okay.
And so really trying to spread the love, if you will. And again, give back to the community. That's why we're all here. We want to take care of patients, take care of our community, and that's just another way we can do it.
Yeah, we talk about that on the show all the time, not just in healthcare, but like keeping stuff local, supporting local businesses, support the businesses that sponsor your kids' baseball teams, and spend your money here local with the companies that have a vested interest in this community doing well. And so I love to hear that as well. I know another question that I wanted to ask on prevention. The preventative side of medicine, which I think as a whole, we don't really talk about enough in the U.S. as a whole. From what you see, injuries that you treat, like with respect to orthopedics, what are some things that people can do to not have to see you?
Yeah.
Right?
Man, it starts early. I think we learn these things with our bodies about bending and twisting. That's probably the biggest thing with your low back, right? We get in a position where we're like, especially men, you just don't want to say no to lifting that refrigerator.
Correct.
With your buddy that's moving into his apartment.
Then pop.
And yeah, exactly. So, if you're going to bend and lift something, you got to keep your spine straight. You bend at your hips and your knees, not through your lumbar spine.
Right.
Mm-hmm.
Keeping a healthy weight is really important. Exercise actually is so important. Exercise from a cardiovascular standpoint, exercise from a coordination standpoint. Mm-hmm. I feel like a broken record even saying this to you guys, and you haven't heard it yet, but I say this probably 15 times a day. Somebody wants to, they come in to see me, their back hurts, and they say, well, doc, I got this brace at Walmart, and it helps a lot. And do you think I should wear it? And I said, actually, no. You should not wear the brace. The brace is doing the work your muscles need to do.
That's right.
To build them up, yeah.
So that means that your muscles are not as robust as they could be.
Getting weaker.
They're getting weaker. Yeah, absolutely. And so then you take the brace off, and then you go for an hour and you're okay. And then at hour 2, you're not so okay, and your back's hurting again. And then you want to put the brace back on. Mm-hmm. If that person would go and do core exercises and build the brace on the inside, that's really what I want my patients to do. And I don't know. I feel like sometimes patients are like, man, therapy, can't you just fix me? But
Give me a pill.
that is, yeah, I mean,
right? No, I'm saying that's what they
sometimes.
want. That's the mentality of the patient.
I want to
or-
walk in and walk out done.
No, they just want to take a pill and make it better. That's what they want.
I mean, I would love to give you a pill and fix your back problem.
Right.
But you got to put in
that would
work.
make me happy. That would make you happy.
Mm-hmm.
We can high five. That would be great.
Right. It's not how it works.
Unfortunately, it's not quite that easy. And really, again, more things that I try to teach people when they come and see me is it's about managing the symptoms. Our bodies are breaking down every day. A lot of it can be repaired, and it does get repaired up until the age of maybe 40. And I'm about to turn 40, and it's gonna.
Welcome to the club, buddy.
1 month.
Oh yeah. Wait till you say that out loud.
Yeah, 42.
I'm 41.
I just turned 42.
Yeah, last weekend.
Yeah.
But no, in all seriousness, I mean, our bodies do break down over time, and it's an sort of unfortunate reality, but it's happening to all of us. And your body is less resilient as you go through time. And so these things that maintaining that weight at starting at an early age, doing core exercises and staying active throughout your life on a regular basis. I mean, those things are massively important. So, I mean, we can go through the other things. Nicotine is terrible for you.
Right.
Any way you get it, whether it's vaping, smoking cigarettes, cigars, chewing gum, nicotine isn't healthy for you. It constricts the blood vessels. It has some other effects. It slows down bone healing. I teach my patients with osteoporosis, why did I get this lumbar compression fracture? Well, we get these micro cracks in our bones all day, every day, and your body's really good about repairing those micro cracks. Well, when you have osteoporosis, your bone building cells can't keep up with the micro cracks, and eventually they will fail, especially if you have an accident, you fall off a step or miss a chair. And so the body is just, is not able to keep up anymore.
Yeah.
So,
do you recommend any supplements for that? Vitamins, any of that stuff? Calcium, milk?
Drink your milk.
Drink your milk. Yeah.
We all grew up in the 80s,
Yeah.
90s.
So once you get to osteoporosis, calcium and vitamin D aren't going to be enough. So you may need to be on a bone building medicine. But yeah, calcium, vitamin D, very important, especially the vitamin D part of things. People are much more deficient in vitamin D now than they used to be, because we don't spend much time outside. And, we have fortified foods, milk being one of them, vitamin D, fortified milk. And it does help a little bit, but it's probably not a lot of us at the age of 40 or 60 drinking a ton of milk.
Right.
The kids, they do really well with it. So vitamin D and calcium, very important. You probably, just in general, I like my patients to be on that supplement. Multivitamins can help. Turmeric is another one, musculoskeletally, that's been shown to have some anti-inflammatory properties. So if you have joint pain, shoulder pain, knee pain, back pain, turmeric might be helpful for you. And it's relatively cheap. It's over the counter. You get it at the grocery store. You can add it to foods as flavor, a little bit of flavor, but you can also just take it in pill form.
Right.
Okay.
So
I know when I hurt my back, it was, I was trying to be He-Man and lift a stump up, but my back went out, but it was actually the muscles around my back that cramped up and almost where I couldn't walk. So how do you know the difference between you really messed up or your muscles are just weak and you pulled those?
Yeah. Acute 10 out of 10 pain. That's the muscle cramp, muscle spasm pain.
Right.
And the way I like to explain it, again, just kind of making it make sense to my patients, is you injured something, your brain doesn't want you to do anything to re-injure it or to hurt it more. And so it just locks you down.
Yeah. You can't even walk. You can't get out of bed. You can't do anything.
Can't do anything.
Right.
So yeah, that's the 10 out of 10 muscle spasm pain. So what do you do about it? Most of the time, obviously there's going to be a level where you're like, I don't know that this is okay and I need to go to the ER. And I would tell you, if you're having those thoughts, you should probably just go to the ER or the ortho.
Well, I was going to say ortho urgent care.
Yeah, ortho urgent care.
But generally, most acute severe pain is going to get better with a little bit of time. Anti-inflammatories are pretty huge. You can get those over the counter. And I tell my patients to schedule it. So, doc, I lifted that fridge. I heard a pop. I've got this searing left leg pain and I limped in here. What do I do? And so I'll examine the patient and I'll make sure they don't have any muscular weakness or any of these red flags, which are pretty rare. And then I'll I'll give them anti-inflammatories. That's the number 1 and number 2 medicine usually. Steroids, the research studies don't really support the steroids, but we do it a lot anyways, and I still do it, and I would give it to myself. The downsides are low when you're having that severe 10 out of 10 pain. It does act as an anti-inflammatory a little bit. And so I use that. Then you have the other things, which again, studies don't really support, but they do make us feel a little bit better. Muscle relaxers. And then there's
They wreck me.
Yeah.
Bad.
I mean, they're not for everybody, and we prescribe them, and I'm talking to my patients about these medicines. I'm like, try it once.
Yeah.
If it does okay for you, then you can use it. But if it's making you feel weird or making you loopy, or, you're going to be a fall risk, we don't want you to fall and get hurt more. And so, I do tell my patients to try and I guess ease into it a little bit.
Right.
But most of it's going to get better. Your body is going to fix a lot of things. There's some cool studies out there where they look at these patients that have these really big disc herniations. They have a disc herniation, they come in, they get an MRI, and I guess with a study, you can get an MRI right away because some company or facility is paying for it versus fighting with insurance.
Yeah.
Well, you haven't done
Right.
6 weeks of therapy.
Right.
Yeah. Pre-authorization.
Yeah,
Least invasive to
exactly.
most invasive.
So they come in, they get this MRI, it shows a big disc herniation, and in 6 months, most of them are gone. There was one that I saw 14 out of 15 are gone in 6 months. And so most herniations, it feels like the end of the world, but they're going to get better. And if you're the rare person that it doesn't get better, then we can fix that. And that's why I have a job for real.
Yeah.
Most of it can be taken care of with some medicines and time, but yeah.
So when you've done the heating pad and the ice
Yeah.
and you've done all that stuff, if we're still hurting at the end, we really need to come see you
Come
because
check
there's
it
probably
out.
something different or something more intense.
Yeah. I mean, like I said, 2, 3, 4 days.
Yeah.
Is fine to kind of wait and see. Once you get into the week to 2 weeks and you're still, missing work and all that kind of stuff. You need to come see somebody.
Yeah.
I gotcha.
And like you led with, though, it's like, and I've watched some videos and stuff. It's like stretching and staying active is worth its weight in, what is it, an ounce of prevention is worth a pound of cure, if I'm saying that right. It's like, it really does. I watched a reel on Instagram the other day. It showed it was like PE class from the 1930s and 40s.
Where to climb up the ropes and
Yeah,
stuff.
well, they're like doing all kind of like bending and rolls and
Right.
stretching, and I'm like, could you imagine if you work in high schools, what would happen if they tried to make kids do that today? What would that look like?
They cry in the corner.
It wouldn't happen. I don't think that's for the better, and I think that's just going to like cause a lot of issues in the long run over time as patients, as kids become 40, 50, 60 years old if we don't change some stuff.
Yeah, I think my comment on that is starting a regular exercise program early, and I think it goes back to nutrition too. It's been a little while since I looked at this, but they consider pizza a vegetable on some school menus, right?
God,
so they're
crazy.
looking at the food groups,
Yeah.
and pizza goes in the vegetable category, and it's like, well,
I don't really know about
maybe
that.
not.
I don't think pizza's really a vegetable. Yeah.
I don't think we're doing a good job teaching our kids nutrition in school. What is a carbohydrate? What does it mean to your body? What is a protein? What does it mean to your body? What is a fat? What does it mean to your body? And depending on your time of life, if you're 10 years old, you need nutrients and fat and carbs and protein in probably a different ratio than if you're 50 years old with a desk job.
Yeah.
So
my 15-year-old can eat a whole row of cookies, and he's 150 pounds and still got a six-pack. If I look at bread, I gain 5 pounds.
Yeah.
You know what I mean?
Yeah. So we need to do a really good job. And the part about that is not just about learning nutrition. It's about, this is life. When you get 50 and 60 and all that breakdown has added up, you're going to be so much happier. You never get to take 2 paths. You only get 1 path.
Right.
And you're going to be so much happier when you get to 60 and you're like, man, I did eat right most of my life. And, I had birthday cake when it was my birthday, and I had birthday cake when it was your birthday.
Right.
Yeah.
But I didn't live on birthday cake.
Yeah. And I had steak every, once a month on Friday night with my family, whatever it is. But most of the time I ate, a healthy, lots of fiber, lots of vegetables, lots of, I guess, really, we're getting off the bone stuff here, but I guess fruit items with lots of water content, right? That's what fills you up. That's what makes you satiated.
Yep.
And that's how you one of the ways that you can eat healthy. There's
Yeah.
there's so many facets to that. I'm not going to go deeper.
Yeah. We'll
Well,
be here all night.
the bones are in the body, and it's a holistic
Yeah,
approach,
it
right?
is.
It has
It really
to, it has
is.
to be
Yeah.
looked at that way. And I think that sometimes, as healthcare as a whole, we kind of get away from that, and I don't think it's helping us. You know what I mean? So back to the basics, man. Eat good, stay active.
That's right.
That's right. A body in motion.
Right.
It's easy and it's hard. But,
Or just eat an apple a day. I think I read somewhere about that. It keeps
We
the
won't
doctor
need
away.
any.
It keeps
We won't
the
need a doctor.
But I'm
if we
here
just eat
anyway.
an
Right, but
apple.
he's here
Yeah.
anyway. He's here anyway.
In case you forget that one.
Was there anything else that we hadn't touched on that you wanted to cover topic wise?
I think we covered a lot of stuff.
Yeah.
The background, just I guess, were we signing off?
No, I just want to make sure you got
yeah.
notes over there, and I want to make sure we didn't miss anything.
Make sure we hit
on the
everything.
notes, hit all the time, because I don't want Lee coming in here and getting mad at us, because he was very, very descriptive,
Adamant.
adamant that we covered everything.
Yeah.
That's Lee Bond, the CEO of Bienville, who he promised us today that he would come on the show.
Yeah.
So that's going to be a future episode as
It's going to be a great show.
It is going to be a great
He's
show.
an interesting guy.
He
He's
is.
so smart, so talented.
Yes.
So
Yeah, he's
I'll be
very,
watching that one.
very good at his role too.
Yeah.
So I can't wait till we get in that. Well, Dr. Cox, I want to thank you for stopping by this
100%.
evening. I know
Thank
you
you.
guys, man. I see y'all in the OR, and just listening to you talk about the training and like the brain trust between you and your partners. Like, y'all do a lot, man, for the community, and it's a gym here to have Bienville and all the doctors that we have on the Gulf Coast that truly, like you said, man, you want to take care of patients, you want to take care of the community, because when something happens to you or your loved one, health wise, you run to your doctors, you run to your healthcare organizations, and to have Bienville here in the community it's a real gem. So I thank y'all for that and everything that y'all do.
Absolutely. It's a pleasure and an honor to take care of our community and, more fun things to share. We live in a community that's relatively small.
Yes.
Again, it's not a big city, and
100%.
I see patients everywhere I go. And so it is really quite an honor to be able to take care of people and get them back to life. So I'm really excited to continue doing that for our community and, and the people that I know.
Absolutely, man. Absolutely. Well, we appreciate